Hello and welcome. Today, we're diving deep into a fascinating yet serious eye condition called Nutritional Optic Neuropathy, or NON. This condition affects the optic nerve, the vital cable connecting your eye to your brain, ultimately impacting your vision. We'll explore its causes, symptoms, diagnosis, and management. So, let's begin our journey to understand this complex disorder. Nutritional optic neuropathy arises from a deficiency of essential nutrients. Think of it as your optic nerve going hungry. Key culprits include deficiencies in B vitamins like thiamine B1, riboflavin 2, niacin B3, pyridoxine 6B, cobalamin C B1, and folate. Other contributing factors can be copper deficiency, or, in rare cases, excessive levels of toxins like cyanide, often linked to cassava consumption without proper preparation. Conditions leading to malabsorption or poor dietary intake, such as alcoholism, bariatric surgery, and restrictive diets, significantly increase the risk. So, what happens inside the eye when you're nutrient deficient? The precise mechanism is complex and still being researched. The primary target appears to be the retinal ganglion cells and their axons, which make up the optic nerve. Without sufficient nutrients, these cells struggle to function properly, their energy production falters, and they become vulnerable to damage. This damage initially affects the papillomacular bundle, the area responsible for central vision, including visual acuity and color perception. Over time, chronic nutrient deficiency can lead to irreversible optic nerve damage and permanent vision loss. Nutritional optic neuropathy is a global concern, disproportionately affecting populations with limited access to diverse and nutritious foods. It's more prevalent in developing countries or regions with endemic malnutrition. Specific populations at higher risk include individuals with alcoholism, those undergoing bariatric surgery, patients with malabsorption syndromes, and individuals adhering to very restrictive diets. However, it's important to note that NON can occur in any population where nutritional deficiencies are present. The symptoms of nutritional optic neuropathy often develop gradually and are typically bilateral, meaning they affect both eyes. One of the first signs is often a painless blurring or dimming of vision. Color vision is usually affected early on, with difficulty distinguishing between reds and greens. Central vision is typically more affected than peripheral vision, making tasks like reading or recognizing faces challenging. In severe cases, vision loss can progress to profound blindness. It's crucial to seek immediate medical attention if you experience any of these symptoms. Diagnosing nutritional optic neuropathy involves a comprehensive eye examination and a thorough medical history. The eye exam includes assessing visual aquiline vision, colored visual fields. The ophthalmologist will also examine the optic nerve itself, looking for signs of pallor or swelling. Blood tests are essential to identify any nutritional deficiencies, particularly B vitamins, copper, and other relevant markers. Neuroimaging, such as MRI, may be performed to rule out other potential causes of optic nerve damage, like tumors or inflammation. The diagnosis often relies on a combination of these findings, along with excluding other possible conditions. While we don't typically classify nutritional optic neuropathy into strict types, its severity can range from mild to severe based on the degree of vision loss and optic nerve damage. Early-stage NON may involve subtle changes in color vision or visual acuity, while advanced stages can result in significant and irreversible blindness. The duration and severity of the nutritional deficiency also influence the progression and classification. The primary goal of treatment is to address the underlying nutritional deficiencies. This typically involves high-dose supplementation with the deficient nutrients, often administered orally or, in severe cases, intravenously. Dietary modifications are also crucial, focusing on a balanced and nutrient-rich diet. In some cases, physical therapy, occupational therapy, or mobility training may be necessary to assist with activities of daily living. It's essential to work closely with a healthcare team, including an ophthalmologist, a neurologist, and a registered dietitian to develop an individualized treatment plan. Preventing nutritional optic neuropathy is all about ensuring adequate nutrition. This involves consuming a diverse and balanced diet rich in vitamins and minerals. Individuals at risk, such as those with alcoholism or malabsorption syndromes, should be regularly screened for nutritional deficiencies and supplemented as needed. Public health initiatives aimed at improving access to nutritious foods and educating populations about proper nutrition are also vital in preventing this debilitating condition. The prognosis for nutritional optic neuropathy depends on the severity and duration of the deficiency, as well as the promptness of treatment. Early diagnosis and treatment can often lead to significant visual recovery. However, delayed treatment or severe nutrient deficiencies can result in permanent optic nerve damage and irreversible vision loss. Recent research focuses on understanding the precise mechanisms of optic nerve damage in NON and exploring potential neuroprotective strategies to mitigate the damage. Clinical trials are investigating novel therapies that may enhance visual recovery and prevent further vision loss. These ongoing research efforts offer hope for improved outcomes for individuals affected by nutritional optic neuropathy.